I'm unveiling to you right now. He will introduce himself, and also remember to ask as many questions as you may right here within this hour. Karibu sana, sir. How are you?
I'm good.
It's good to see you.
Thank you for having me in this show.
Thank you for choosing to be with us on this show very early in the morning. Now let's start with your name, what you do really, because you people have a lot of things you do, a lot of hats you wear. So I want to allow you to, engage with my guests and let them know what we really expect through this conversation.
Thank you. I'm a physiotherapist. My name is Moses Katasi. I practice in private institution at Katasi Physiotherapy Services, and I also consult as a physiotherapist at Hongton Medical Center. So today, in respect to back pain, as a physiotherapist, I'll just go to showcase about the role of physiotherapy. What does physiotherapy play in terms of managing back pain?
Yes. Okay. Before we go deeper into this conversation, I need a bit of definitions for those who really don't understand what physiotherapy really is. What is it?
Yeah, physiotherapy is basically treatment. It's treatment of diseases, injury or deformity at a certain extent of severity. And it uses physical methods. And these physical methods entail manual therapy, what we say hands-on approach, where we use exercises, we use joint movement to reduce stiffness, and also we use electrotherapy and other approaches, intervention in physiotherapy. So physio itself is physical, and then therapy. So we are trying to treat diseases, check up on injury, and deformities of certain severity without medicine and surgery approach.
Without medicine and surgery approach, and most of people would rather opt for that. I know how many people must be asking themselves, does it really work? Someone asked, does it really work? We're looking forward to some of your success stories, if there are any you could mention. We're also looking forward to, in the next discussion, having a case, that you have handled and successfully has come out of the pain. Now, speaking of, physiotherapy, before we get into illustrations of this, who needs, physiotherapy? People have, quote unquote, thought this is a thing for the old.
Yeah, physiotherapy is very wide in terms of practice.
Yes.
The need of physiotherapy in the community is really, really something to be checked on because it works along the disciplines in terms of muscle and joint pain and diseases. We have an approach in cardiorespiratory physiotherapy.
Cardiorespiratory?
Yeah,
okay.
We do check on patients who have issues with their cardio and respiratory system in terms of rehabilitating.
Okay.
We also do that. Also in terms of neurological cases, these neurological cases goes around to stroke, cerebral palsy. We go to children, pediatrics.
Okay.
We do handle children who has delayed developmental milestones. We work with the sports fraternity, the athletes. So we also work with the geriatrics, the old age individuals. So it is really, really a wide perspective in the community in terms of physiotherapy.
All right, we'll talk about the cost later. The assumption of psychiatry and physiotherapy in this era is that it's really, really expensive. Now, I'm looking at somebody who is now watching this morning and thinking, could you give us an illustration? Now, we will focus on one of the major, conditions or situations that require physiotherapy, and that is back pains, backaches. We're either driving too much, our lifestyles are really different right now, children are always watching TV. We are pretty much in buses, right from your house, you're seated, in a matatu, you get to the office, just a minute walk and you're down seated. I don't even know. Before we get into this illustration, what are some of the causes of back pain as we begin?
Yeah, so back pain has many causes. And before I just run into the causes of back pain,
yes.
There is a bit of misunderstanding about the back.
Yes.
Because the back itself is just the rear end of your body, from the shoulders all the way down to the level of your hip. So when you have back pain, it means you're having discomfort or pain from the end of your ribs or the costal margin of your ribs to the region of your hips.
Okay.
So, and this pain can be localized. This pain can be just within that area. the costal margin and the end of and the rib region, and the hip region, and it can be associated with either pain radiating down the leg, past the knee, or not passing far from the knee. So back pain itself, by definition, I'll just paraphrase it in terms of definition. So it's just discomfort and pain, the way I've said, from the costal margin of your ribs to the gluteal folds, or where the buttock muscle crease ends. There is where now you have back pain, normally the gluteal muscle. Let me use the academic terms. So generally the prevalence of back pain in the general population worldwide is around 60 to 80% of the population.
That's a lot.
Yeah. So, and you'll find out that in adults, it ranges up to 80% of the general population, at least adults will suffer from back pain. And 23% of the adults will have severe chronic back pain.
Severe chronic?
Yes.
Okay.
Yeah. That means it's 3 months to 2 years, 10 years onwards.
Persistent.
So, yeah. So when you look into perspective, it is really an issue in terms of economic and social division, in terms of, you know, even the growth of any country and all that. Going forward, you go down and look at the other population, like the adolescent population. It is also coming up about 11% to 33% of the adolescent population. And that one not being enough, back pain is now within 11 to 12% as a cause of disability along the global population.
And that, of course, sets the pace for this conversation. You have now seen why it is very important for my guest and I here to discuss in depth and further the back pain and in relation to physiotherapy. Now, if you are going through any of these, let's take a look at the causes, and then now you can go deeper into your presentation, sir. Causes.
Yeah.
What are the causes of back pain?
Okay. The causes of back pain, we describe the causes of back pain. They can be as specific or non-specific. So the specific causes of back pain is as a result of a disease. Disease, let's say you have an infection, or you have a disease, let's say cancer, or any associated disease that will result into back pain. But more importantly, that one is just around 10% of the cause of back pain.
Okay.
The major cause of back pain is around 90%, and the 90% of back pain is referred as mechanical back pain, or simple back pain. And this type of back pain is as a result of soft tissue. Soft tissue is just the muscles around your back. It's about the disc. You've heard about disc bulging. You've heard about a sprain or a strain, somebody lifting something heavy. So those are the major causes of back pain. And most of the time is also associated with occupation. So a lot. Yeah.
All right, now let's go into the treatment, and that is physiotherapy. If you're dealing with a back pain, you can ask as many questions as you can. We can get your answers right here with Katasi. Now, give us a bit of, you know, the illustrations and walk us through really the type of back pain. What does physiotherapy then do, so we can understand in depth what physiotherapy then does to actually help deal with back pain?
So the first thing, when you have back pain, when you visit a physiotherapist, or let's say you visited a doctor who has referred you to a physiotherapist, a physiotherapist, what he or she will do an assessment. First of all, to screen out is your back pain from an original cause of a specific cause. Okay. To screen out, is this back pain really can be managed by a physiotherapist? That is just to check on the red flags. Am I going to manage this type of pain? Now, when we assess a patient who has back pain, from there we are going now to do our screening. The screening will involve movement in terms of trying to ascertain how limiting is back pain affecting you. And that one is more detailed, is about impairment. Okay, what has back pain made you not to do in terms of activity, in terms of even the way your posture has been conformed. And after that, we also check, further than that, we also check other factors that are associated with back pain, just still in the assessment.
Yes.
And that one will involve the psychological approach.
All right.
Because when you have back pain, it's really a trigger, you know. You wake up in the morning, you know, you can't step down, you can't drive. You know, it hits up to your level of intensity and pain, and this one becomes a psychological perception if you are suffering back pain for a very, very long time. From that one, we also check on your social environment, your occupation, your work environment. Is it a contributory factor
All right.
towards the complaint? So then from there now, we now assess.
Okay.
After now finishing the assessment, we lay down a treatment approach. We now have to give you, is it an advice, you know, self-care, reassurance. We have to reassure you, even if you've lifted something heavy,
Okay.
the next minute you can't bend, you can't do anything. We have to educate you and reassure you that this pain is just a reaction because of a strain of what has happened. And that one doesn't mean that you are going to have this back pain for the longest time.
So it isn't severe yet, or are you just giving hopes?
Yeah.
After the assessment, it depends on what degree of the back pain it is that you have these guarantees and a reassurance?
Yes.
Okay.
Yes. So because that one is very important, and that one is what most of the time is being missed. And most importantly, if you don't give reassurance to a client, it becomes a problem. If you don't give reassurance, if you don't explain to anyone about what really is the cause, you know, if you've lifted something and your back is stiff, you know, as an individual, I'll want to understand, why is my back hurting me?
Absolutely, absolutely.
Yeah? So that one is very important. We have to educate our clients about, you know, what does the back itself entail in itself, you know. The back pain itself, it's in a basic structure of a spine, and the spine entails the discs and the nerves around.
Okay.
So when we explain to the patients about this, educating them, they be able to understand that within that onset of pain, they can be able to get benefit from physiotherapy.
Allow me to interject, because we were looking at a viewer who is now asking, why are we not getting then what is, you know, those are just processes of where the treatment is headed to and which type of treatment you get. But really, people have said physiotherapy is pretty much massage. Is it the same thing?
It's
or
a
which
physical,
types of physiotherapy do we look
yeah.
at treatment now, so that we go into the illustration?
Yeah. So physiotherapy, as I said, it utilizes physical methods in terms of treatment. And physical methods, that is hands-on. Hands-on approach.
Okay.
And hands-on approach, we refer it as manual therapy.
Okay.
And massage is just an approach, it's just one of the interventions under manual therapy.
Please tell us more. We are curious. We want to know more of which other types, because a common man should just say, oh, Nende massage.
Yeah. So now there is a difference now, because now with manual therapy is basically manipulation. Manipulation is just relieving tension within the tissue. It can be tension within the tissue, and the tissue in this aspect is the muscle. Okay. It can be relieving tension or stiffness along the joint, the back, the spine itself. So manual therapy is one of the aspects that is being used, but massage is just an approach. When you compare a typical massage, let me put it in quotes to separate from physiotherapy, which is therapeutic massage, which means it is treatment.
All right.
A treatment-based. It's an approach that goes with evidence, okay? Because we are doing it with a reason. We are identifying specifics, tension in a specific muscle.
All right.
And our intervention is pretty much specific to a certain muscle or a certain group of musculature components. So, and when you compare that with the local massage or just the usual massage for relaxation, basically this is just a gross aspect of relaxing and, you know, just let me say it's leisure.
All right.
Okay, but therapeutic, we are specific because we have to assess, identify when you are having back pain, there are muscles that are tight. So as a physiotherapist, I'll be able to understand out of how hundreds of muscles in your body by assessing you in terms of movement, bending, lifting, what muscle specifically was strained. And there's now where the approach of physiotherapy becomes different, because now we check on that one.
Which specific muscles are we looking at really?
The back muscles as a whole.
All right.
Well, the back muscles as a whole, they are muscles that are pretty involved, and the back muscles are very robust. Okay?
Yes.
They are the ones that give stability to your back. Deep, we have layers of muscle. We have the superficial muscles on top. We have the deepest muscle inside that hold adjacent to the spine,
Yes.
and others that just hold within the spine bones themselves.
Okay.
So apart from that approach of manual therapy, which is therapeutic massage, joint mobilization, and we also have therapeutic agents that we use. These are, if you have back pain, you will hear someone complaining of pain radiating down the leg. Okay? This is because of tension of a muscle impinging a nerve, especially, let's say, on your hip region. So when we release that specific muscle through therapeutic approach of manual therapy, it can be through joint movement, relieving tension around the hip region to stretch out the muscle so that the nerve can be relieved from tension. And massage itself, we use electrotherapy through nerve stimulation. And
now we're getting deeper. There's electrotherapy as well.
Yes.
All right.
And then we have also the heat therapy that we use to relax the muscle. And also at times also we incorporate even ice, depending on the stage of the onset of back pain.
All right.
And many, many other approaches.
When you mentioned, ice, I'm going to go back to the level of the Mwananchi again, or the common viewer, who, you get ice for your headache real quick, or something hurt you, to put ice on it. Is this the same approach?
Yeah, it is the
same approach. Is it just deeper?
Yeah, it is more similarly the same approach.
Okay.
Because if you have the first incident of any injury, is it a muscular type of injury or a strain? Maybe you've strained your ankle or you've strained your shoulder. The first approach is normally to ice the area.
Ice the area?
Yeah, when you ice the area, basically the first response in terms of any injury is inflammation. Okay, because there's a lot of inflammation around the area. So when you ice, the essence of icing in terms of healing, it is just bringing down the swelling and enhancing more of circulation around that area. All
right, what should someone avoid through these physiotherapy moments? Because when we are under some sort of medication, there are things we avoid. When someone is already doing physiotherapy right now, and I also wanted to know how many years or how long it takes to be under physiotherapy treatment. But before we go to that, tell me what to avoid as somebody who already has a back pain.
Okay.
Yes.
So for you to, when you have back pain, avoidance is dependent on the extent of the injury and the time frame and period.
Yes.
Okay. So when you have back pain, it will be depending on pain. If it is bending, okay, you can avoid bending just at a certain extent, at a certain period, okay, just depending on the severity. But that one doesn't mean that bending is an issue. But the most important thing to avoid in terms of when you have back pain is you have to engage in movement. You don't have to restrict yourself because you have pain.
A back pain, okay.
Because that one is going to just conform and make your back muscle very, very stiff. What you also need to avoid is you need to try and see a way of exercising. Okay. Don't just sit a lot, because when you sit a lot, you are putting a lot of pressure and your muscles are not working that much.
All right. So do not sit a lot, but nevertheless try to move. Movement is important.
Yeah.
Now let's look at treatment. How long depending, you can give us a case study, you can give us a unique situation and how long. And I don't know, I just need to understand, because I know you could go for your cancer treatment. I know that when you're in your gestation or expected month, there is the first trimester, you know, the second and the third, and there are certain antenatal and postnatal clinics they go to. How is it for physiotherapy?
Now, for physiotherapy, it's a bit dynamic.
Okay.
Because it's dynamic because the back pain that you feel, the back pain that you have, and the back pain that I will have is different.
Okay.
Depending on the cause and depending on even the nature of work that you do. Okay, so in that dynamic approach, when you have back pain, the time frame of healing is different.
All right.
Because depending on the stress that is there in the tissues. If you are having back pain that involve being hit by something, let's say in a car accident, okay, we shall have to assess and see the level of extent of injury. If you're having back pain because of your nature of work of sitting, that one is different.
Okay.
So in terms of healing, it will depend also in terms of your perception in terms of pain. So back pain in the first 1 week, in the first 1 week, if you're having an episode of back pain, you are supposed to, when you see a physiotherapist,
yes,
within the 1 week, your pain should subside. That one is just the acute onset. When your back pain, sometimes the back pain can last for three months. That is a chronic type of back pain. And the extent of recovery and the time frame is dependent on at what time are you seeking treatment. If you are seeking the treatment earlier, your response towards back pain will be much faster.
All right, just like any other condition, just
Yes.
like any other disease.
Yes.
The earlier the better.
The earlier the better. Yeah.
I know we're going to go into the illustrations, the directives once I receive them, so you can actually see practically what happens. When we get ready for that, it will be more exciting really from back at home to see him illustrate really how this would look like, how they do it, because I can tell you Kenyans and Africans for that matter can be a bit skeptical on a few issues. And the one thing that you have mentioned is that it depends. Everyone has a unique type of back pain. I'm looking at someone who has, you know, has back pain due to other diseases, like you said. If they are suffering a certain type of disease that has caused them. Can you give us some unique approaches to this? Because there's so many people watching today that are either dealing with diabetes or, you know, the many other conditions that have come in, and they're looking at how they can probably heal through this, you know, physiotherapy.
Yeah. So in the dynamic of different types of back pain, for instance, I will just talk about compensation. Compensation is when you have back pain for lasting for a very long time without seeking treatment, your body changes. Okay, you have back pain at the extent of which you bend yourself in one side. It brings a lot of compensation on your back. In another case, let's say you have a degenerative condition or degenerative changes in your spine that we call it osteoarthritis. Sometimes you hear someone say they have spondylitis. Okay, that is another type of case for back pain. Now, the approach of the two is just to try and identify and know that there is a lot of compensation in both cases. And as if you have back pain in these cases, it is good that when you seek physiotherapy, it will be good to be assessed very well, to check on the muscles that are being compensating, because you might have back pain and muscles will become tight and the compensation will round up from your core muscles, your hip muscles, and even the upper back. So the most important thing for you to manage this type of back pain is through exercises.
Exercise.
And when you exercise, according to research now, if you just work on your abdominal muscle, strengthening of the abdominal muscle, in all types of back pain, you'll be able to manage back pain.
Amazing.
And, yeah.
Amazing. I interrupted there, but I did not say stop. So I was just curious on the abdominal, you know, exercises. Which exercises are this that we're looking at?
They're strengthening exercises.
Like, you know, some of us here don't really know which is which. We just know how to jog in the morning.
Yeah. So basically, abdominal exercises, you can do them in a lying position.
All right.
Okay. You can do them in a lying position, and then you can lift your legs, bend your knees to 90 degrees, and then you just stretch out, okay? But before you do that, you have to breathe in and hold your breath, and you feel the abdominal muscle is tight, okay? When you feel the abdominal muscle is tight, you hold the tightness on your abdomen muscle, and then you start stretching up, stretching out the leg. Most of the times you'll hear about planks. Planks is a type of exercise that you bend on your elbows and then you stand on your feet.
Oh, yes.
Yeah, so that you engage the core muscles.
That's also an abdominal exercise.
An abdominal exercise. So still, when we say exercise is very important, just a precaution when you are doing this is that you don't overdo these types of exercise, especially if you have back pain, because when you have back pain, you need specific graded exercises. For strengthening the abdominal muscle, a physiotherapist will showcase you how to do that type of exercise.
All right, I like when you have talked about do not overdo. I think so many times people have been told do not overdo. They do not know the implication that overdoing an exercise would have on their muscles and therefore on their bodies. I want us to take a very short break. We come back still with the big conversation talking about physiotherapy. Feel free to ask as many questions as you can. Were you given a wrong prescription, or are you doing well within the prescription you're given? Is there anything you want to ask about as far as physical therapy is concerned? Talk to us, use the hashtag #TheMorningDrift, and we'll be right back after this break.
Health Check in association with
Natural Juicing Center. Your health is your wealth.
Benefits of fresh juices. Fresh juices are packed with soluble fiber, a type of fiber that supports good bacteria growth and digestive health. It has been shown to regulate blood sugar levels, lower cholesterol, and slow the transit of food through the digestive tract.
Health Check in association with
Natural Juicing Center. You can now book for any service or order for food supplements on our website www.naturaljuicingcenter.co.ke. You can also visit our center in Kahawa Sukari, house number 1334, Kahawa Sukari Avenue. Natural Juicing Center. Your health is your wealth.
Get a chance to wake up as a tourist as you view Mount Kenya every day by buying a plot of land at Wema Gardens, Maru Moru. At only 400 meters off tarmac, this is the right place to build your dream home, cottages or holiday homes. You can also buy this property to give to your children as a special inheritance. Water and electricity are in the vicinity, while neighbors are already building their homes. These plots are specially ready for you with title deeds scheduled to be out in 6 months. Buy a 50 by 100 plot of land at Wema Gardens for only 399,000 Kenya shillings. You can also pay for your plot through our friendly 1-year installments plan. There is starting possibility.
like, follow, subscribe, click the notification button. Join the Lookup TV movement now.
Welcome to Lookup Guest House, Retreat and Prayer Center. When you first come in, we will be happy to receive you at our reception, then proceed to our cozy and well-located accommodation facilities. We aim to provide our guests with a unique, comfortable, and worthwhile experience. Here at Lookup Guest House, we provide our guests with a continuous supply of room amenities. a cool environment for all your retreat activities.
Look up Guest House Retreat and Prayer Center. For reservation, contact us on info@lookupguesthouse.org or call us on 0746 788 707.
Kwa habari kutoka kaunti zote nchini Kenya.
Habari zinazoangazia masuala yanayokugusa moja kwa moja ni habari kutoka mashinani. Tunakujuza kuhusu uchumi.
Hakuna haja ya kufika kura. Tunapigia viongozi gani? Na sisi tunapata tabu.
Kilimo. Afya.
Sisi kama wahudumu wa afya ikifika saa 6 usiku hatutakuwa kazini.
Uzalishaji na siasa katika kuelimisha na kutoa hamasa ya kipekee.
Tunataka uchumi wa Kenya usaidie mkubwa kwa wadogo.
Ungana nami Lame Kaungo ninapoleta taarifa hizi hapa Look Up TV.
Welcome back. This is the big conversation, and thank you very much for joining us. I can see you're all very active on Facebook, and I can see here Anna Timothy saying, super proud of you, Katasi. Very, very great discussion about this noble profession. I can see saying, and you're looking very sharp, classmate. Thank you very much, Ann Timothy, for that feedback. Is it Myron Yahuma? Myron Yahuma saying, big up. Naona unafanya ile kitu. Thank you very much for, of course, your big up. Fishtown KE saying, a very healthy conversation. Fish were locked from City of Angels. I hope you're picking one or two things for your own, health this morning. Saida Mutanyi saying, good job, Daktari. Of course, Daktari is still here with me on set. I'm still learning so much as well, especially when it comes to occupation. You get to sit down a lot. Perhaps you're just really dealing with your back pain and you're thinking, what should I do to just feel good again? We're here talking about physiotherapy, and I want to welcome back on set, Daktari Katasi. Are you guys called Daktaris?
Yes.
It is treatment, but it is physical.
Yeah, it's physiotherapy. You see, in healthcare, in this practice, you know, when you learn, you have to, you will end up attaining your doctorate. Yeah, and physiotherapists are recognized as doctors. Because now the physiotherapy field is really advancing now, especially in our country now. We are having the master's program, we are having the PhD program. we're having our colleagues specializing in orthopedic physical therapy, neurorehabilitation, pediatrics.
Amazing.
Yeah, so it's really a field that is coming up.
All right, and that's why I'm seeing one of the viewers here saying a very noble profession.
Absolutely.
Right now, we're just going to go a notch higher, as we promised the viewer, to now actually seeing what it is like to actually have Daktari in action. So we'll have an amazing lady. She's called Bistina. She's joining us. Sijui ametuvalia tu mask, lakini ni sawa. So Daktari, you'll feel free to show us then a few, things. First, because I see it's an office setup.
Yes.
So perhaps there's somebody who is suffering from back pains because of their occupation.
Yes.
Maybe walk us through that, and then, I don't know, I'm waiting to also learn from this set right here. Karibu.
Sure. So this set, in terms of occupation, is one of the contributory factors to back pain, and it relates to what we talk about as posture. I know you've heard more about posture.
Yeah.
And posture is just the attitude that your body assumes in terms of controlling with your muscles and even engaging in activity. So it's not only...
Please engage in activity, Bistina.
Yes. So for her case now, he's now assuming a posture with assuming a certain position with her body.
Can I ask, usually when we go to work, this is typically an office chair and an office desk, or even a study desk. So most of the times I'm looking at secretary, receptionists, CEOs, whoever it is. Of course, CEOs have a little better chairs, they can lean back or so. Is this the right posture first? Because sometimes it's how we sit that, over time affects us. So which one, let's start with which is the right posture first to even prevent the back pain if possible.
Yes. So the ideal posture in terms of statics, now posture is divided into two. Is it a dynamic posture or a static posture?
All right.
So this one is more typically of a static posture.
Where she is?
She is.
How she is?
Yes, she's either sitting or even standing.
Oh, okay.
And even picking something from up. That one is more dynamic. So in a static posture, now we just check on the curvature of the back. And we first of all start with the neck, first of all the head, how the head is positioned. So for her case, the way you see how her neck is, it's relatively a bit in a neutral position. But when you go further, you will check also on how the protrusion of the neck in terms of when she's using
I wish she didn't have a hoodie on, but let's just see if we can still see the neck.
Yeah, so you can, when you check on that, the position of the neck and the angle diversion towards your screen, and also the back, the curvature. Are you slouching back on your upper back? Are you moving off the seat? Okay. How is the level of your typing keyboard towards your seat? You see, for her, she's putting her hands much higher.
The wrist,
yeah. So there is more pressure on the shoulders. There is tension on the elbows. So the ideal posture for you to use is to just ensure that your head is in a level position. That is the first thing.
So less of this?
Yeah, not that way. Because now when you bend forward, your head is approximately something like 3 to 4 kilograms.
Oh, yeah.
Typically. So,
wow, that's huge.
So when you just bend forward, you're increasing the axis of the force. So when you do that, when she does that, so let's literally, she's bending that way, she's increasing the axis. So all the weight is going forward, and that one affects the curvature of the neck. And that not only affects the curvature of the neck, but it strains the muscles around the neck region. And if she's going to stay here for 20 minutes, she will start pulling her neck that way because
we see
of
that
fatigue.
a lot because of fatigue.
Because of fatigue.
So the muscles are a very integral part of the body.
Absolutely.
Oh, nice.
Absolutely.
Okay.
So when you check about that, now we come and the way she's seated now, you see this position. The ideal position is that your ears and the shoulders needs to be in the same alignment. So just to prevent this, push your ears that become in the same alignment with your shoulders, so that you avoid slouching back. And then your elbows, the elbows and the hip direction are supposed to be in a relatively 90 degrees.
Okay.
So when you do this, she has moved a bit forward. Okay. So it's being giving a bit of tension on the upper back. So in ideal position, this seat will be a bit higher.
Oh, okay, okay.
Yeah, this seat will be a bit higher so that the level of the elbow is relatively equal to the level of the seat chair. Okay, then we go to the hips. It's supposed to be a bit 90 and the knee 90 at the same time.
All right.
And your feet are supposed to be relaxed on the floor.
Relaxed on the floor.
Yeah.
It's not a good idea. Some of us, okay, who would rather put it elevated on, because there are desks that have a place you could put your leg on. It's not a good idea. Would you rather it's on the ground?
Yeah, it's okay. It's okay. If you get something to, now that one depends on how the level of your seat is.
All right.
Because
okay.
if your level of your seat is a bit higher and the desk it's also a bit higher, so you've come up. So it's ideal. You can get a wood or a bunch of files. Sorry to say that.
No,
so that you can put your legs so that you can, as much as your feet are supported on the floor.
Amazing. I'm looking at now first for all of us, because I know everyone, almost a lot of people, even entrepreneurs these days, must understand this sitting position.
Yes.
Because you say that 70 or more percent is of those back pains are contributed by this occupation. So I think it's really helpful if you're watching from the office that first, if you are also an employer, you check on the seats that you have, if it's in the staff rooms, if it's in the newsrooms, because then we're trying to avoid, number one, preventing, right? That's what we were talking about. But now we want to go into, now she has a back pain.
Yes.
I don't know, walk us through some of the first exercises, or what do you expect the physiotherapist to be checking on? I don't know how practical this is on TV, but with the guidance, maybe you can show us what's possible with the set we have. Before you do, let me just read this feedback from Bundi Daniel, saying that's an awesome conversation, Katasi. We need to have more of these talks because many people are suffering from these conditions. I'm proud to be a physiotherapist. Wow. Thank you very much. Now we are looking at, first, do you have your sitting in order to prevent the back pain? But if you're already dealing with back pain, not only from the occupation, but other issues like we mentioned earlier as causes, what can you do at home, or what would your physiotherapist do, or what can people back at home help you do as exercise? All right, let me see if it's possible.
Now, let's still.
But our person is still working, so I think that they're dealing with the pain. How is the pain? You couldn't hear her, but she said it's unbearable. So please take us through that.
So this posture, now, the first thing that you're supposed to do in this workstation, you need to get time to walk and relieve yourself.
Okay, so she needs to walk.
Yeah, you can stand up from this position.
Could you please stand?
You can stand up. So, and one thing
and what she just did, just sit again.
Yeah.
Most of us, and there's something about pulling the chair back and pulling it front. Is there any type of strain you put on yourself if you don't do the ideal moving slightly back, and because then there's a position you also leave the chair with? Perhaps you could do that again.
Yeah, so that one can also lead to a strain on your back because you've sat for a very long time, okay, at a certain position that has strained you. And you know when you sit in an uncomfortable position for long, when you wake up, you feel tiredness. Okay, so when you move out, outside, and then let's say your cloth is being hung up on the corner of a desk, you know, you are going to strain, and that strain you're just going to hurt your back.
So what is the proper way of leaving the desk after a strenuous sitting position?
So the proper way is just to push the
Please
seat
help
back.
us do that.
Okay.
She stood and pushed it.
Yeah.
That's okay.
Yeah, that is fine.
All right.
That is fine. Also depending also on the weight, okay? But just push it slowly. You have to just relax, push it slowly outside, and then move as if you are not in a hurry. Because it's your office, it's your workstation.
Okay.
However anxious you are, or you are accommodated with a lot of work, that is fine.
All right, now because of time, we're going to look at then a few moves, maybe in 2 minutes perhaps, and then we can close.
Yeah, so she can come over here.
All right.
So, when you've sat for long, the major exercise that you can do is just to stretch. You can do stretching.
All right.
And
How?
stretching, let's say you've sat for long. I want her to do with me.
Okay.
So just like go down as if you want to touch your knees. So you feel a stretch on your back. okay, and also on your hip, and then you come back. Most of the time, try to face this side. When you have back pain, mostly you normally feel discomfort around this region of the back when you sit for long. And this one can be relieved by another stretch on the wall. So you can just do a wall stretch. You hold yourself on the wall this way, so you face on one side, and then you put one hand that way, and then you just make a C shape that way, okay? You see the way she's feeling?
Yes, she felt it. She
She
did.
really needs to see a physiotherapist after this because of that tension. Because it's really a bit of tension along the back muscles that are really, really very strong.
Was that intense? Just nod for me if it was. Was it intense? Yes. Perhaps you need to nod so that yours is, because you don't have a mic. Is it intense?
Yes, it is.
Okay.
Yeah, so that is it. So you stretch your back on the sides,
yes,
and then you can also, they also have to stretch some of the muscles on the front side.
All right,
okay?
Just one more so that we can close.
So one more exercise is you just can just do this, and then you push yourself.
You're very fit, Daktari.
Yeah, I have to. Yeah. That way. So you're stretching the front muscles and also the back muscle. And other exercise you'll be shown by your physiotherapist.
Okay.
They range away from even strengthening specific muscles on your body.
All right. Thank you very much, Bisina. I think you will just sit as we close together. But Daktari, how do we find you on social media for a follow-up? Because we're going to have more of these conversations, I believe. But really, this is not the end of it.
Yes.
There are many other issues that need physiotherapy.
Yes.
But for someone who hasn't gotten a chance to ask their questions today, until the next discussion, where do we find you on social media?
On social media, on Facebook is Katasi Physiotherapy. You can also find us under Hongton Medical Center. At Libra House. Katasi Physiotherapy is in Upper Hill. On Twitter is Katasi Physiotherapy. On Instagram is Nairobi_physiotherapy.
Nairobi_physiotherapy. And of course, we're looking forward to the Healthy Inside Out. Don't be surprised if I come back with Daktari, if I decide, therefore, that your public demands that Daktari continues with this physiotherapy talk shortly, before we get into another discussion still on matters health. But before you go, Daktari, allow me to read this. Amisi Benjamin is saying, informative talk. Thank you, Daktari. Saida Mutanyi saying people should stop taking medicine and check out for physiotherapy services. Back pain, arthritis, happy to be a physiotherapist and women health specialist. And Redemptor Masea saying, impacting knowledge to the world. Thank you very much for watching the big conversation all about physiotherapy, and we get ready for the big, for the inside out. But like I said, we could surprise you and come back still with Daktari if you publicly demand. We'll be right back.
Are you looking to turn your passion to purpose? Vera Beauty and Fashion College now brings you online classes at the comfort of your home. We are a TVET approved institution with over 20 years experience in training competency-based courses